Hello everyone, welcome to
Hello.
the day 2 of Healthcare Transformation Summit. I Harshal Desai on behalf of eHealth Magazine and Elets Technomedia Private Limited welcome all the panelists in this panel discussion which is on emerging opportunities and risk in telehealth. As you are aware, uh, this is the second edition that we are organizing and this is the day 2 of the Healthcare Transformation Summit. We had a very wonderful first edition recently, a few months back, and we had got a tremendous support from different stakeholders in our first edition, and we are fortunate to have the same support. In fact, more support from our speakers and our partners and our key stakeholder for organizing the second edition of Healthcare Transformation Summit. Today's panel discussion is on emerging opportunities in risk in telehealth, and I'll just take 1 minute to introduce all the panelists. We today have with us Dr. Sandeep Chatrat, Regional CEO and Group Medical Director from Metro Hospital. Welcome, Dr. Chatrat. We have Dr. OP Yadav, CEO, National Heart Institute. Welcome, Dr. Yadav. We have Mr. Hufeza T. Merchant, Head IT from Safi Hospital, Mumbai. And our fourth panelist for this session is Professor Dr. D. Bhattacharya, former Director of Ayush, Department of Health and Family, Government of Assam. I welcome you all, sir.
Thank you.
Thank you very much.
Thank you. So, before we start asking questions to every panelist, I would request everyone to share their opening remark in about 2 minutes on the subject. And I'll start with Dr. OP Yadav, CEO, National Heart Institute. Your opening remark on this subject, which is emerging opportunities in and risks in telehealth. In 2 minutes, sir.
Thanks a lot, Herschel. See, not long back, we used to look at telemedicine and telehealth as futuristic and, very expensive kind of a technology. And it has, in a very short period of time, courtesy the fillip given by COVID, it has seen not only upscaling of these services, but even mainstreaming of telemedicine, so that it is not an outlier anymore. We have come to realize that that's the necessity. It has not only just got a future, in fact, it should be one of our prime modes of delivery of healthcare in the future. Besides the existing, this should be our prime mode. Now, there is some confusion about what is telemedicine and telehealth. So here I like to clarify that both are essentially synonymous. As WHO calls it, it's delivery of healthcare services over a distance for the benefit of the patient. Typically, health medicine or telemedicine deals with the so-called traditional healthcare delivery centers of preventive, diagnostic, and therapeutic services, while telehealth takes us outside the traditional healthcare centers into open arena, and behavioral change and those kind of things are also kind of factored in. But overall, both do the same purpose, that it bridges the gap, the skewed distribution we have of our health resources, both human resources as well as infrastructure resources between the rural and the urban areas. So this kind of a time kind of blurs that skewed relationship between the two, and equitable, accessible, affordable, and easily available, at the same time cheap and quality-wise equivalent healthcare services can be delivered. So it is something which need to leverage upon and build upon. Thank you.
Thank you so much, Dr. Yadav. I would request now Dr. Sandeep Chatrat to share his opening remark on this subject. Dr. Sandeep.
Yeah, thank you very much. I think telemedicine is the next big opportunity in healthcare, and we have clearly the advantage of enhanced access because India lives in villages, but the medical practitioners and doctors are concentrated in metros, and clearly there is a divide between tier 1, tier 2, and tier 3 in terms of resources of manpower of doctors. So telemedicine has a great advantage in terms of enhancing the access to the healthcare because doctors are more concentrated in tier 1 cities and patients are more concentrated in tier 2 and tier 3 cities. Definitely there is important advantage of improved and enhanced turnaround time,
Mm.
and also the real time consultation which is possible through the telemedicine. So these three are the very big advantages. And nowadays, especially during COVID times, we have seen through smartphones, tablets, laptops, PCs, the teleconsultation and virtual consultations have revolutionized the healthcare delivery, which is so important. So it is a change which is catalyzed by disruption of COVID, and I think it has a huge potential. Also, in our country, there is scarcity of doctors. And if we quote the WHO data, we see clearly we are having less number of doctors, and especially less number of specialist and super specialist doctors. So it's the one of the best medium how we can optimize our resources of doctors, utilize them in a best way to treat the masses, and it has a growth potential of CAGR of 31% for next 5 years going forward. And India is tipped to have it will go to $5.4 billion industry by 2025.
Mm.
Telemedicine in India, so it has a great opportunity.
Right. Thank you so much, Dr. Sandeep Shafrat. I would now request Mr. Huzefa T. Merchant from Sefai Hospital to share his opening remark on this subject. Mr. Ha, Mr. Huzefa.
I think,
Yes, we are able to hear you.
yeah, are you able to hear me now?
Yes, yes.
Yeah, thank you, Mr. Hashel. Thank you, Mr. Hashel, for presenting this opportunity. And I thank Elets once again for presenting this opportunity of being a panel member on once again. Today's topic is very interesting. Yes, like Dr. Yadav and Dr. Sandeep have already made some opening pointers here. Telemedicine has always been around for more than a decade now. It was spearheaded, a lot of initiatives were spearheaded under the banner of the Telemedicine Society of India itself. I myself have been part of I have attended quite a few seminars and conferences which were organized in the earlier days. And yes, but today the scenario has changed. My observation on this is that while telemedicine and telehealth both have been there, telemedicine is a subset of telehealth, uh, wherein the remote diagnostic and clinical services are provided to the patient remotely. There are two or three other aspects of telehealth, wherein the patient education services, continual of patient care outside the beyond the normal care, clinical care. Then patient part of it is patient remote monitoring services. They also form a part of telehealth, and also nowadays the mobility has provided by the gadgets and like your fitness watches or whatever you're wearing. They have provided a new perception and a dimension to telehealth services in all. Having said that, yes, the the this COVID area has seen has perpetrated a kind of a disruptive nature.
mm,
in this business. Okay, it has disrupted this entire business of telehealth and telemedicine services, and it has given a spur, a boost, uh, which has enabled the adoption and the acceptance of these technologies on a far more larger scale. And for the first time, doctors and patients might have been looking at these at both these aspects in a very different manner. Telemedicine role models like Narayana Health Services in the south, they've always been there, and they have established successful business models in this regards. So the acceptance factor, the previous, the moving, now today what we are seeing is a shift in perception, both in the doctors as well as the patients, from the conventional approach of physically examining a patient, of physically of doing a clinical diagnosis physically, to a remote diagnosis. So this, yes, there is going to be a lot of pros and cons for both, and I hope that in this current session that we are having, we will be discussing most of those points. Thank you.
sure. Yes, yes. Thank you, Mr. Zefa. I now request Professor D. Bhattacharya to please comment on the subject of telehealth in about 2 minutes.
First of all, I want to thank the organizers for giving me this opportunity, and all three panelists already described everything on this matter, so I have not to say much on it. Uh, this telemedicine was popularly, it was going on since 10 or 12 years, and nowadays it slightly changes, who changes this and make it as telehealth with some broader way. Here, if I actually, basically I'm a homeopathic doctor, so if I go from that side, Ayush side, or from homeopathic part of side, then this telemedicine helps much more in homeopathic practitioner and the patients who are dealing with the homeopathic doctors,
Mm,
because we need the symptoms similarity, the patient symptoms, that is, we need the, actually all systems need symptoms, but we need the peculiar symptoms or the abnormal symptoms, uncommon symptoms, to select the remedy. So in this case, the telemedicines, particularly after uh, the introduction of smartphones, etc., the Zooms, or other medias, electronic medias, it becomes more popular. And particularly in COVID condition, COVID pandemic conditions, it becomes more and more popular. And patients also get benefits, and they have some mm, such type of benefit. Then the maximum, already told our earlier speakers, that the maximum doctors remains in the metro cities, and they do not want to go, particularly the specialists do not want to go, or they have no time to visit the village area, remote area, so that patient can directly contact with them and gets benefit from this. That may be from any system, that may be from Ayush systems, or maybe from allopathic systems, or so I think these systems will mainstream in near future.
mm.
Thank you.
Thank you, Dr. D. Bhattacharya. Uh, Coming to Dr. Sandeep Chatrat again with our next question, I would like to understand what is the drastic change that you have witnessed in the last 6 months in telehealth, and how telemedicine is a blessing in disguise in times of COVID?
That's a very good question, Harshal. And I think, as I mentioned in the beginning, this is a change which is catalyzed by disruption. Once we are fighting the battle against COVID, which is a very infectious disease, the importance of social distancing and use of technology, which we have seen now, companies like Practo, Doc Prime, Mfine, Call Health, they have become household names. And almost all the hospitals have adopted the technology in a more proactive way, which is again one thing which has been catalyzed through the COVID. And definitely, I see a huge potential going forward. There was reservations earlier. There were issues related with acceptance of telemedicine and telehealth as a technology tools by few members of medical fraternity. But once they have seen the importance and the relevance in current time, that has been overcome. Like
Hmm.
hand washing has become a norm, so telemedicine and telehealth and virtual consults have also become a norm, which is again catalyzed through the COVID. Also, I think that there is a huge bridge between rural and urban healthcare, and somewhere we find that telehealth has helped a great deal. When I was Central Regional CEO for Apollo, I remember we inaugurated more than 100 telemedicine centers. And now virtual consults and now virtual consultation through Metro Healthcare, group of hospitals we are doing in our all hospitals. And this has become something like the new normal sort of a thing. And if you don't practice it, you are not able to effectively deliver healthcare. And again, I want to emphasize that India has shortage of 6 lakhs doctors. We are short by 6 lakh for our doctors and by nearly 2 million short by the nursing staff. This is the WHO data which I am quoting. And where the optimization of technology is always required, and somewhere where the contactless examination, especially during the COVID era, because of high adoption of infection control practices, it has become something like a new normal and has been. People have embraced the technology to a greater extent, and the main driver for that has been the patient centricity,
Right.
because patient also doesn't want to come to the hospital exposed. Doctor also is able to effectively use the technology in giving the guidance. So I think there is a great marriage of both embracement of technology and patient centricity
Right.
during the COVID era.
Right. So, Dr. O.P. Yadav, taking clue from what Sandeep Chatrat ji has just mentioned, uh, patients are, of course, benefiting from telehealth and telemedicine uh, mechanism. But what I would like to understand from you is that people residing in cities, in metro cities, probably are making most of the telehealth, right? Do we also have seen some trend where this practice is being, adopted by the people who are residing probably in rural areas? How have you seen this trend? If you have something to comment on this, and how after post COVID we should take it forward, the telemedicine process. Dr. Opia, you're on mute.
Okay, thanks, Harshal. Uh, yes, telemedicine has seen traction both in the urban and the rural areas, though it is driven more in the urban than in the rural areas. But ultimately, it's the rural which are going to benefit
Hmm.
the most out of it. It's those far-flung areas not well connected with a lot of distance where these facilities we have been just talking about. Sandeep mentioned all, great shortage of doctors. That's the group which is really the most is going to be benefited the most. The
Yes.
elderly are going to be benefited the most. The women folk are going to be benefited more than the men folk, because they are the ones who don't get a chance to leave their homes. They have to, pack for their husbands and the children and do homework and household work. And before time is over, the child is going to come back. So these are what we call as the vulnerable special groups who are especially going to benefit from it. And what demonetization did to the financial sector, the same fillip has been given, not man-made this time, but God given by COVID. We must always see every difficulty and disaster has a window of opportunity, and we should not curse God for giving us COVID. We should not look at what we can make the best out of the COVID. And one of the benefits we have of COVID is that the telemedicine, which has been lagging behind for so long, though we had realized its value, it's now leapfrogging, and it has got every chance of inverting the healthcare delivery paradigm. And the peripheral and rural areas will get the same kind of what we call equitable distribution of healthcare resources as the urban areas. And we run a small telemedicine setup with the Uttarayana Foundation that we run in Kumaon Himalayas in Almora. And I'm telling you, the percolation of mobile telephony is so much that telemedicine is not always expensive gadgetries. Even a simple mobile phone can be used. X-rays can be transmitted by taking a photograph. ECG can be transmitted by a photograph. They can transmit their whatever medicines they are taking. And we can use a local nurse or a physician assistant or a community health worker or a ASHA worker to decipher some of the technical things and communicate with us. So
Yes.
overall, I feel it's got great future.
Right. Right. Great. Thank you so much, Mr. Merchant. I'd like to ask this thing. You are from the IT background and managing information technology for one of the biggest hospital in centered in Mumbai, right? What are the drastic changes that you have witnessed from that part of side when it comes to telehealth and telemedicine processes at Safai Hospital?
To be very
Yes.
honest, am I audible? Yes. Yeah. To be very honest, from the technological point of view, the technologies that we are using now, and for the teleconsultations or video consultations between doctors and patients has always been there. Okay. There are two, three points that I would like to speak about on this. One is that within the cities today, the availability of infrastructure, availability of resources is very much present. Okay. Now, if you are to talk about the basic infrastructure that is needed, the most basic being internet connectivity. If you are to talk about that in the rural area, for instance, the percentage, the population and the penetration and the quality of the internet is still 2G in most rural areas where it is available. And even the availability and the
Mm.
infrastructure is still low. So that is an obstacle in itself. Again, like I had said previously at the start itself, that it is not something that it has not been there, and we have developed some new system during this COVID times to overcome the obstacles that we are facing uh, for the betterment and improvement or facilitation of medical services to the patient. The technology has always been there. Most of it has been. What has changed is the availability of newer gadgets like your smartwatch. Just recently, there was a news
Yes.
article, I have shared it with the respective panelists also, that there was a person who, using a Apple smartwatch, was able to recognized that something was wrong with his heart, and he consulted a doctor, and eventually a month or two down the line he got his heart surgery done. And he even has sent an Twitter response to Mr. Tim Cook at Apple. He was from Indore. Similar condition has, similar case has also been cited elsewhere. So this is one very basic thing. Today, BARC has built up a ECG machine, a portable ECG machine, which is just the size of your mobile phone, and it fits into your pocket. So it has made life very simple for people to monitor themselves. Certain things which people needed to go we are able to do now at our homes. Our SGO2, our oxygen level and heart level machines, which we are commonly using to monitor our COVID situation, even if people who are quarantined in our houses, that is readily available. Blood sugar, all these devices have always been readily available. Today, there are systems in the ICU which can communicate with your ICU in the hospital of a patient's condition, even as he is transported in an ambulance to the hospital. So, such systems are readily, constantly monitoring and feeding data from the patients to the either the doctor or to the institutions, the healthcare institutions, and they are making life much more easier for preventive as well as continued healthcare services. So that is yes, like I said, but where the difference is going to make it is like. To give you an example, before COVID, we did not know that we were going to use telehealth and teleservices. Today, 6 months, 7 months down the line, the system has evolved that way. And by evolve, I mean people have gradually accepted the change. Doctors have gradually accepted the change. Okay, now we need to do this. Work from home was never a concept before
Yes.
this pandemic. So similarly, telehealth services and telemedicine services was never accepted because why should I go to a video call and have a video call with my doctor when my doctor is so readily accessible to me? And today, even though we say that with all the finer nuances and positivities of the new technologies as discussed right now by the in this session, I personally, as a patient, would still prefer to be seen by a doctor, and this is most common in the Indian cycle, in the Indian psych. So I would still prefer, and clinical diagnosis requires most of the times to be clinically diagnosed. So there's every possibility that there might be a difference in what the patient is telling you today across the video consultation, and what he might exactly be feeling, or there might be a difference. So what I'm trying to communicate here is that while there are the possibilities, yes, the other side of the coin is that there might be offsets also for both for the doctors as well as for the patients.
Right.
So that is one. And technology is, of course, it has been there. I spoke of there are the other aspects of technology that is now being coming into focus is the cloud aspect. So there are platforms that are available today who are offering services, um, consultations as a service. So you don't have to have anything. Today there are reporting facilities like cloud packs, systems, emailing systems can be used for emailing the patient's reports. WhatsApp is available. So there are lots of mediums, and all these have been around. It is only now that how we have started using these medium to the best of the as suited best to the current times and to the current scenarios.
Right, right. Thank you, Mr. Merchant. Mr. Dr. Bhattacharya, you have been in the government for a long time. So my next question is to you: that looking out from a policy perspective, what changes you want to see coming in for telemedicine and telehealth? Dr. Bhattacharya, if you can please share your input on this.
Many times we have get some information from the doctors that they get some problems that may be from legal aspects, or may obtains collecting data, etc. Because sometimes these medias, electronic medias like Zooms, etc., anything that may be from their it may leak out. So this some confidential matter may be there. So this sites may be rectified. So I think there should be a panel or some groups to be a government should take, or from the part of the research organizations, they may take some uh, initiative where all streams doctors and from the health ministry and Ayush ministry should sit together to finalize something that they should uh, this is one point, then this type of problem should be removed. Again, there are some other constraint that may also be removed. Uh, we If we avoid the constraint, there are several constraints, no doubt. So if we avoid the constraint, but it is seen that the this telemedicine is always helping the patients. Even government also thinking on the government also giving the preference to this telemedicine or telehealth care systems, because the in many times government want to send the doctors to rural area. They actually make some they make compulsory to complete their PG course to go to the rural parts. But it is seen that in some doctors they give the penalty, but they do not want to go there and goes to some other they ready to practice private, ready for private practice. So in these conditions also the patients from the rural areas always gets uh, problem from getting proper medications or proper health cares. So in these conditions also, it is to be upgraded in this way. The legal side should be in such way developed that they should get benefited.
Right.
So these are the main points, and we have some other points also. Not immediately.
Okay. Okay, I think there is some network issue from Dr. Bhattacharya's end. So, same question I would like to ask Dr. Sandeep Chatrat also. What are the policy perspective? What changes that you want to see, coming in for telemedicine? Dr. Chatrat, if you please can share your views.
You see, I think there are three main policy perspectives which we have to think when we are talking of wider adoption of telemedicine. First is that there is a telemedicine guidelines of 2020 which have been framed, and I think this is a very important guideline which government has framed, and will go a great way, a long way in further enhancing the reach of telemedicine into the villages, into the rural areas, because the guidelines are very important because we are sharing the data, and the rules and regulations which define the sharing of data are of paramount importance. So government has come up with the telemedicine guidelines of 2020, which are, I think, a very important step going forward. Second thing is that there is a need for regulation for widespread deployment of telemedicine. You see, without regulation, without rules, without guidelines, it is felt that there might be misuse, there might be not a proper and a professional way of implementation, and it puts all the players on the same platform. That's the main thing. So, this regularization of the telemedicine space is very important. We feel that the telemedicine infrastructure challenges are being overcome through the telemedicine, and this is one thing which government and everyone appreciates and understands. And there is a huge momentum and a wider focus, and momentum is in favor of telemedicine because of the infrastructure challenges which we are facing. We have huge country. India lives in villages. where the technology is the only bridge to overcome the urban and rural divide between the resources, between the manpower shortage. And I specifically want to highlight this, that because there is disparity in the distribution of resources, as I mentioned to you, that the number of doctors which are short, the nurses which are short, this is something which is something very important for us to understand at this stage, because we are short of resources, manpower, critical manpowers. 6 lakhs doctors short in India and 2 million nurses shortage. So definitely the technology is the only bridge. So
Mm,
the regularization of this space, the implementation of telemedicine 2020 guidelines, and the increase in the adoption of telemedicine because of the infrastructure challenges. I remember when I was with Apollo, we implemented one telemedicine center in Ladakh, now which is 6 months not accessible by road also.
mm,
So you see the sort of challenges which are there, and now through the COVID era, what we have seen in metro group of hospitals, in all of our metro hospitals through MFine, we have implemented the virtual consultation platforms in which the doctors are widely using and adopting this technology, and patients are also using it. You see, the success of a technology depends on both the parties, from the patient and from the doctors. So both have found it to be of a high importance and of a good value. Then only this is being implemented successfully. So I think it has a huge scope and it has a huge advantage going forward, because COVID is not going to go. We know now the third wave is being talked about, and nearly 1 crore people have got infected in India, and we see 10 lakh people have died in India itself. So
yes.
this is a disease which is not going to go easily. And until and unless we find a vaccine, we are having a very strong treatment modalities towards this to prevent the disease. So definitely, I see that these regularizations, these guidelines will go in a wider way, and through the NHA, National Health Authority, through the National Health Authority, there has through the Ayushman scheme, through their IT portal, lot of new initiatives are being rolled out, which will further give impetus to telemedicine.
Right, right, right,
Thank you.
right. Now let's move to our next question. Now, a lot of we've spoken about how telemedicine and telehealth is crucial, and the it's gaining momentum across urban and rural cities and areas. Many teleconsultations happening now. The next question comes: making payment for consultation digitally, which is seen as a huge problem, particularly in tier 2 and tier 3 cities. So I would like to understand from Dr. OP Yadav, how do you see this? Is it a fact that we are facing the issue of digital payments for teleconsultation? You're on mute. You're on mute. Yes.
It goes automatic. Well, if you permit me, can I go back a little just to, because a
Sure.
little Dr. Merchant said if I'm the one, I would prefer to go for in person consultation, which takes away from the merits of. I
Right.
believe if something is not good for ourselves, then what business do we have to ever recommend that to our patients? Now, here I want to clarify. I fully agree with this point as long as that is my first visit, and if it is dealing with an acute issue or an acute problem. But there is, a Cochrane review, which is the ultimate, a review of 93 randomized controlled trials. That if you're looking at chronic illnesses, for example, control of diabetes, hypertension, heart failure, then telemedicine is as good as in person contact. So I thought people may get a wrong message that if a doctor himself wants to be seen in person, why must he debate for the next 1 hour telling telemedicine is the ultimate answer? So we have to differentiate between acute and chronic care, and we also have to differentiate the level of telemedicine.
Right.
Telemedicine can be a totally illiterate man speaking on his cell phone, versus something on fax. I'm transmitting data and geography. My heart rate is being transmitted. My nerves are being transmitted. That's the ultimate. So
Yes.
even that has to be factored in. Now, coming to your question about payment and all, well, first, I'm not the right person in the sense I'm not a finance man. No, there have been some issues when the problems have been less payment transfer. The problems have been more that even though IRDAI, the insurance regulatory and authority, has said that teleconsults would be reimbursed under normal policy if that policy covers outpatient cover, yet we find some of the time the TPAs or the insurance are challenging the teleconsults we have had, challenging the purpose for which the teleconsult was held. Was it worth a teleconsult? Suppose you just say, I've got a little scratch on my head, and you pick up a phone and both people are charging. And because of lack of documentation on the part of the medical fraternity, because under the Indian practice guidelines, which Sandeep just referred to, there is a proper template which has been laid down. That template includes time of the call, whether an implicit or an explicit consent was taken, the medications have to be put down. So there are a lot of details. And because of the improper documentation, we find that there is a problem in these payments. But I don't think we have as much a problem with the technology for transfer of payments.
Right,
Thank
right, right. Rightly said. We recently, I mean, just before this session, we had a session on digital payments and mechanism in hospital and healthcare ecosystem across the country. So we do understand that digital payment is certainly not a problem. However, it can be an issue with the people who are probably residing in rural areas. It may be for there might be many reasons for the same. Internet connectivity is one of them. Second thing, probably they are not aware of this digital mechanism. Now, again, I'll go to Dr. Sandeep with my next question. What are the factors which are still constraining the growth of telehealth in India, if not the digital payment? What can be the other issues that we are probably facing when it comes to telehealth?
You see, the biggest challenge is the infrastructure, and because to connectivity through the internet as well as through the computer and through the broadbands, because India lives in villages where still the access to internet is not there everywhere.
Hmm.
So I think the number one challenge which we face is of the infrastructure, and this is the biggest challenge which is impeding the establishment of more telemedicine centers. Also, the cost of setting a telemedicine center, because you need to the technology in place, is also the economic consequences, and the economic impact is also significant, which is not affordable by all. Of course, by big corporates, it is possible, and there is a lot of CSR work which is being done. But smaller hospital, mid-sized hospitals find still it a very big challenge, the economic impact, because there is uncertainty on the return on investment which is going to happen over a period of time. So economic impact is definitely a second thing. And the third thing I think is that there is a lack of awareness about regularization, about the various guidelines which govern telemedicine. You see, ignorance is many times blessed, and it is like this that government has framed 2020 guidelines of telemedicine implementation. It needs to be known to doctors, it needs to be known to administrators, it needs to be understood in letter as well as in spirit. Once that happens, the wider adoption of telemedicine happens 360-degree across our country. Because if you see the geographical challenges which are there in our country, we have high Himalayas, we have so many difficult terrains which are inaccessible 6 months in a year. So I think telemedicine and technology, through the use of broadband, through the use of internet, through the use wider adoption of tablets and mobile phones now, because mobile phone is one thing which has become so widely used. I think this challenge is something which is getting overcome, and we just need to have a faith into this, and we need to understand that this is the new normal which I mentioned in the beginning. And there is no point that wastage of time in traveling huge distances, difficult terrains, difficult geographies to reach a doctor, and especially a super specialist doctor, which is very much scarce in numbers in our country. So
Hmm.
I think we have to embrace the technology in a broader way, in a wider way, and I think by adoption of technology in a broader way, we can definitely achieve our goal. And of course, the population size of our country. You see, such a huge population, and where the technology has to be used for the advantage. Because if we use the technology for our advantage, then only we will be able to achieve health for all, which is our
Right.
health mission, to achieve health for all. And we have to embrace the technology. And specifically, I want to say that we have seen during this COVID era that patient centricity and the patient belief and the advantage which they get through virtual consults and telemedicine is the biggest catalyst, which is going to in future also ignite and further enhance the usage of telemedicine in our country.
Right, right. Coming to Mr. Merchant, how has you experienced this telemedicine post since the time we saw the first case of coronavirus in the country? How, if you can please share your input on how your doctors are responding to it, how the patients are responding to it, how many patients are actually willing to seek the telemedicine, telehealth services in your hospital. If you can please share some insight into it. Mr.
Thank you,
Martin.
Mr. Hashan. Thank you, Mr. Hashan. Am I audible?
Yes.
Yeah. Yeah. Uh, just before I begin, I would like to clarify one thing. Thank you, Dr. Yadav, for clarifying the point, of course, that my opinion and my statement was in the context of the larger Indian psyche and the psychology of the Indian patient as it existed before this pandemic. Because I've already mentioned in my earlier talks that uh, up till now, what we never saw the acceptance level. So the pandemic has disrupted the medical service model, and and it has evolved. That is exactly what I want, what I meant when I said that it has evolved. So it has become more accepted, and yes, it might be more and more accepted because eventually we have to understand that whatever the technology and whatever the platform that we use for consultation, it is eventually going to be the experience of the patient and the doctor at that given point in time, which is going to decide whether the patient is going to come back and whether the doctor is going to continue using that platform. So I may sound from the old school of thought of IT, but I still firmly believe that systems are as good as the people using it.
Right.
So, like what earlier Dr. Sandeep was mentioning, that this it needs to be taken to rural and the benefits of how it could benefit to the rural people. But just to add one point over here that comes to my mind over here is that just by making a mission statement or by this thing, it will we need to look beyond these things. Uh, One, how much is the rate of perpetration or the use of technology in the rural area by a rural uh, villager? Does he know how to use a smartphone to integrate, how to record his own blood pressure, or how to record this thing? Again, like Dr. Yadav mentioned, it all depends on the complexity of the case. It depends on from case to case basis.
Mm.
So this model has perpetrated well, and it has developed well, and it has furnished well. It has flourished well, where people have their primary healthcare tertiary care centers, and they have gone down to the rural areas and set up their primary healthcare centers, or they have set up their clinic levels, where the person who's operating those centers may not be a qualified doctor, he may be a qualified clinician, but he knows and he can facilitate over there the patient coming to your center, to your brick and mortar center, and from there facilitate the capture of the vitals, providing to the tertiary care center, and vice versa. So that facilitation is a must. That is what experience has taught us from whatever little I've heard about the role models that we see today in the country who are making this a flourishing business model. The second point I see and I feel very strongly is that there has to be more public-private undertakings in this sector. If this is to sustain, if this is to develop into a sustained business model, and for that, unless and until the private sector is incentivized, it cannot be like that. Okay, okay, but today this is the cap that is going to be on your service that you're going to provide. There has to be a win-win situation created for the private sector to go out and interact with the government and with the public sector and formulate proper ground level strategies and business models with which can benefit. Now, in this regard, two very nice things that I was reading on the net is, I think recently e-Sanjeevani was announced from the PM's office. The other is the digital health card, which is being rolled out in a few union territories. So those initiatives are good initiatives, and I feel that they will benefit and in bringing quality medical healthcare down to the last person. Coming back to your question again, Mr. Hashan, that what all has been the response? The response in cities and in doctors per se has been a very mixed one, because see, and this I have observed even not just now, but over the number of years. Now, if you were to go to a hospital in the south, for instance, there they have a contract with the doctor joining, and the doctor is supposed to be an on-time, full-time consultant of the hospital. So they have their 0-day policy that okay, we will not give. Our hospital is paperless. For example, say to say, I know of a hospital in South GK where they would say that okay, we are going to go paperless. We are digitals. We will not even provide digital, and the doctor is has to agree to sign to those contracts. The scenario in a city like in a city like Mumbai is very different. I don't know about the other metropolitan cities, but in Mumbai it is very different. The one doctor is going to multiple hospitals. He is running his own clinic. He's probably going to some 2 3 clinics of his own. He has 3 4 doctors with hospitals with which he or she is affiliated, and they are seeing patients. So there, the principles of governance and administration or medical administration and providing care will always vary. That
All
has
right.
been the case over here also during
Yes.
the COVID. Now
Yes.
again, slowly, a few doctors have started picking up in that, and doctors are doing that. But there are still a few doctors who are going back to their own clinics and they are having their own ways of doing that.
Right.
So the
Right.
adaptation has been a mixed one.
Yes. Okay. Okay, okay, thank you, Mr. Josefa Merchant. Now we have got a few questions also. However, considering the time constraint also, but I would like to ask this one question. Someone has asked us from the audience that will telemedicine affect hospital revenue in the coming year? What should be the precautions or strategies to be planned? This is the question that one of our viewer has asked us. So I'd like to ask this question to Dr. Sandeep and Dr. Opi Yadav both. So first, I'll request Dr. Sandeep Chatrat to answer this question.
See, that's a very important question. I think the footfalls to the hospitals are
Hmm.
getting virtual now. And
Hmm.
I think through the telemedicine, definitely the initial footfalls to the hospital gets increased. So it's definitely going to impact revenue in a positive way. As
Okay.
Dr. Yadav has mentioned in the beginning, we are not talking of emergency treatment, right? We are talking of the initial footfall, the initial consultation by the doctor. After that, patient anyway has to come to the hospital. So the
Hmm.
challenge presently is that because in far-flung areas, in distant places, like we are practicing cardiac surgery program in our 12 hospitals in Metro Group, so people want to have an opinion before they come. So
Yes.
there, the role of telemedicine is of very huge importance, because once you are able to give them a line of treatment, that what sorts of whether you want to take it for PTCA or CABG or conservative treatment, whether the patient has right-sided failure, left-side failure, or MI, all that can be very successfully initially screened through the telemedicine. And once that screening happens, the revenue repercussions are going to happen in future, because what's going to happen is that patient is going to come for the indoor treatment anyway to the hospital only.
Hmm.
So I think telemedicine for increasing the footfalls, for prescribing the treatment, and then sometimes specifically in government sectors, patient can go to other places which are nearby also to take the treatment. But the diagnosis by a super specialist and the consultation by super specialist is very important. And
Right.
there, I think there is no doubt in my mind that the technology enabler and embarrasser, we have to embrace the technology in a bigger way. The
Right.
embracement of technology and the enabler power of technology, bytes and the broadbands which are there, usage of technology will enable us more effective way of diagnosing treatment, and especially saving lives. That's the most
Right.
important thing, because if you don't diagnose a patient who has a right-sided failure, or who needs a CABG, lot of scans, lot of reports, lot of clinical symptoms can be discussed by the super specialist doctor through the teleconsult, and which as a first window to the treatment becomes very effective. And later
Hmm.
on you can plan the future of course of the treatment, whether it is for cardiac surgery, whether you want to take patient for any dialysis program, whether it is
Right.
CAPD, or through the hemodialysis program, or for the transplant program. So the advantage in this technology is of a huge value, and I think it
Right.
is the as I mentioned in the beginning, it is the next big thing, and we have to sooner than the later realize the importance of telemedicine as a
Hmm.
very important fulcrum of medical technology, and that is why so many companies and corporates are investing into it.
Sure, sure. Thank you, sir. Thank you so much. So, Dr.
Mm.
OP Yadav, I would request you just answer this in just 30 seconds, sir, because we now have to we'll have to close this. We are on a virtual platform, and the best thing about virtual platform is that we are, bound to follow the time limits. So, Dr. OP Yadav,
Out of my
just
39, 30 seconds, you took away 25. Okay. Now, the cash cow status, if you look at the revenues, almost 75 to 80% of the revenues of the hospital come from acute care and for interventions. I have
Hmm.
a CABG, I discharge the patient in 4 days. The turnover is so much. Next patient comes in, and the chronic care doesn't give me money. So,
Right.
will the revenues be affected? No. Telemedicine will take off chronic care and will reserve the beds for acute care. Revenues will
Yeah.
go up. Thank you.
Right. Thank you so much. That
Harshal,
really very
Mr.
yes. Yes.
Mr. Harshal, just I would like to add just one thing quickly over here to both what Dr. Sandeep and Dr. Yadav has said. The importance of television telemedicine has been expressed, but two things have not been covered. One thing,
Hmm.
as there are two aspects of technology that are going to help and may have to do a lot with shaping the entire future of how telemedicine or telehealth happens. One is artificial intelligence, and the other is machine learning.
Yes. Yes. Yes.
So
That's right.
Now the future may see the doctor and the patient interacting, and in the background the system is evaluating or analyzing what is being said, the symptoms as they are being taken, recorded, and a pre-analysis or pre-diagnosis could also come up. So that is also one aspect that is being developed from the technology. That is an emerging technology. Right? Thank you.
Right. Rightly said, Mr. Merchant. In fact, we had a complete dedicated session on artificial intelligence in healthcare ecosystem. So this part has already been covered in that session, and where panelists spoke about how artificial intelligence and machine learning is going to change the healthcare ecosystem across the country. And that is really very. You rightly mentioned this point that artificial intelligence is also something which will definitely help telehealth technologies, right? It will help telehealth technologies to grow in coming future. So with this, we formally close this session here. I thank all the panelists for sharing their opinion, and we really wish that whatever the best technologies we can incorporate and help the patients, especially those who are living in rural areas. That is when we will be able to say that really telehealth is doing a great job for the patients, also for the doctors. Thank you so much. We will present the certificate to all the panelists. Deepak, can we have the certificate on the screen, please? Yeah, Deepak, I request my teammate to please bring the certificate on the screen.
Thank you, Mr. Hashim.
To Mr. Josefa Merchant, thank you so
Thank
much,
you.
sir, for sharing your valuable input. Thank you.
Thank you.
Dr.
Thank you.
Sandeep Chatrat, Regional
Thank
CEO
you
and
very
Group
much, sir.
Medical
Thank you
Director,
very much.
Metro Group Hospitals.
Thank you. Thank you very much.
Thank you, sir. Dr. Madhav, National Heart Institute Chief Executive Officer. Thank you so much, sir, for sharing your input and expertise at this platform. Professor D. Bhattacharya, thank you so much, sir, for joining us for this panel discussion. Thank you. Thank you, everyone. So with this, we close the panel discussion here. And you may please be there for the next panel discussion as an delegate. It is available. It is live on our website. Thank you so much.
Thank you.